Now next we're going to start the thigh. Now thigh, I told you we have three compartments: front of thigh, back of thigh, and the middle compartment of thigh. Now we're going to draw one line diagram. It is a simple flow chart. That is the cut section of the thigh. Now draw one circle and divide the circle into three halves. Now this is the front of thigh. Now this is the cut section of thigh. Okay. Now this is the front of thigh, and this is the back of thigh, and this is the medial compartment of thigh. Three compartments. See, front of thigh muscles cross the hip joint in the front side. I told you in the upper limb itself. Any muscle which cross the joint in the front side, what they do? Bend anteriorly. That is called flexion. So front of thigh muscles flex the thigh. Back of thigh muscles cross the joint on the back side. They do extension. So back of thigh muscles extend the thigh. Medial compartment of thigh muscles move the thigh medially. They do adduction. Simple. Right. Next, each compartment, they have their own nerve supply. Now the front of thigh muscles, they are supplied by femoral nerve. The medial compartment of thigh muscles supplied by obturator nerve. And back of thigh muscles, they are supplied by the tibial part of sciatic nerve. Tibial part of sciatic nerve. Each compartment, they have their own supply. All the muscles in the back of thigh, they are supplied by the tibial part of sciatic nerve. Right. Now next we are going to see muscles in each compartment. Now in the front of thigh, we have quadriceps femoris muscle. Quadriceps femoris muscle. Okay. And we also have sartorius muscle. We have one muscle. That muscle is present at the junction of front of thigh and the middle compartment of thigh. Now that muscle is our pectineus muscle. So this muscle is pectineus muscle. So pectineus muscle present at the junction of front of thigh and the middle compartment of thigh. Right. What are the muscles in the middle compartment? Now in the middle compartment, we have gracilis muscle. And then adductor muscles. Adductor longus, adductor brevis, and obturator externus muscle. And we have one more muscle. That muscle is present at the junction of the middle compartment of thigh and the back of thigh. That muscle is our adductor magnus muscle. Okay? Yes. And in the back of thigh, we have hamstring muscles. We have hamstring muscles. Hamstring muscles are semitendinosus, semimembranosus, and the biceps femoris muscle. We see hamstring muscles in detail, don't worry. Now please remember, in the back of thigh, we have hamstring muscles. Now these are the muscles present in each compartment. Fine. Now this is a very simple diagram, but from this simple diagram, still we are getting questions. That too about pectineus muscle. Now the question is, what is the nerve supply of pectineus muscle? Pectineus is present at the junction of two compartments. So pectineus supplied by, very good, femoral nerve and obturator nerve. So by the side you can write nerve supply of pectineus. Okay. So pectineus muscle, it is supplied by femoral nerve and obturator nerve. So pectineus muscle, it is a hybrid muscle because two nerve supply. Okay. One more point. What is the action of pectineus muscle? Pectineus muscle have two actions. What are those? Number one, flexion of thigh, and number two, adduction of thigh. Very good. Now these two are the actions of pectineus muscle. The same way, what is the nerve supply of adductor magnus muscle? Adductor magnus muscle, adductor magnus muscle, it is present at the junction of two compartments, medial compartment and the extensor compartment. So adductor magnus muscle, nerve supply, obturator nerve, and the tibial part of sciatic nerve. Very good. Now what is the action of adductor magnus muscle? Adductor magnus muscle extend the thigh, okay, and also adducts the thigh. Okay, right. This is the action of adductor magnus muscle and the pectineus muscle. Right. Now come to the diagram. Now what are the other questions you may get? All the muscles are supplied by femoral nerve except which of the following is supplied by obturator nerve? which are the following not supplied by the tibial part of sciatic nerve? Like this, you may get the question. Another set of question is, all the following muscles flex the thigh except adduction of thigh is not done by which of the following muscle? Extension of thigh is done by. So likewise also you may get the question. So we have 3 compartments. We know the muscle in each compartment, we know the nerve supply, and we know the actions. Okay, right. Now this is a basic idea about the thigh and its compartments. Now first we're going to start in the front of thigh. Yes, femoral nerve supply, muscles, sartorius, and the quadratus femoris muscle. Now in the posterior compartment of thigh, hamstring muscles. The middle compartment of thigh, we have gracilis, attar muscle, obligator externus, and pectineus muscle, junction between the front of thigh and the middle compartment of thigh. Right. Okay. So next we're going to start front of thigh. See, in the front of thigh, in the upper 1/3, we have one surface landmark. That is our femoral triangle. So first we finish the femoral triangle and its contents, and then we can go to the muscles in the front of thigh, and then we discuss the nerves. Okay. Now, yes, this is the femoral triangle. First, you have to know the boundaries of the femoral triangle. I told you, femoral triangle is a triangle in the front of thigh in the upper 1/3. Now, what is the boundary? Now, above. So, the base is above and the apex is below. Now, the base of the femoral triangle, it is formed by one ligament. What ligament? Our inguinal ligament. Inguinal ligament already we discussed in the abdomen itself. It is a thickening of aponeurosis of external oblique muscle. Right. Then, medially, this is very important, the medial boundary. Why? See, any medial boundary of any triangle is formed by the lateral border of the muscle. That is what we discussed in the cubital fossa. The medial boundary of cubital fossa is the lateral border of pronator teres muscle. But in the femoral triangle, the medial boundary is formed by medial border of adductor longus muscle. Medial border of adductor longus muscle form the medial boundary. This is very important. It is not like the other triangles, usual triangles. Okay, this is specific for the femoral triangle. Now we draw in the muscle itself. This is the medial border of adductor longus muscle, and that is forming the middle boundary. We are not including the lateral border of the muscle as a medial boundary. This is wrong. Okay, we are including the medial border of the muscle as a medial boundary of the femoral triangle. Why, sir? Adductor longus muscle not only forms the medial boundary, adductor longus muscle also forms the floor. It is forming the floor and the middle boundary. That is why we are including the medial border of the muscle as a medial boundary. Okay, right, very good. Next, the lateral border of the triangle is formed by medial border of sartorius muscle. So, laterally, the medial border of sartorius muscle. Very good. So, this is sartorius muscle. Okay. Yes. There is a boundary for femoral triangle. So, medially by medial border of adductor longus muscle, laterally by medial border of sartorius muscle, and base is formed inguinal ligament, and this is the apex point. The apex point is the meeting point of the two muscles, sartorius and adductor longus muscle. Okay. Now next, we're going to see the floor muscles. What are the muscles forming the floor? Now the floor muscles are, we're going to see the floor muscles from medial to lateral. I told you already, adductor longus muscle not only form the medial boundary, they also form the floor. So adductor longus muscle, yes, and then pectineus muscle, and then psoas major muscle, and then iliacus muscle. These muscles, 4 muscles forming the floor of the femoral triangle. Okay, so adductor longus muscle, pectineus muscle, and then psoas major muscle, and then iliacus muscle. So these 4 muscles forming the floor. Again, in INSCT exam, I told you, you will get the sequential arrangement questions. Arrange these structures sequentially, forming the floor of the femoral triangle, and from medial to lateral, lateral to medial. Like this, you may get the question. So the medialmost muscle forming the floor is adductor longus, pectineus, psoas major, and iliacus. Medial to lateral sequence. Again, in the exams, you may get the question about pectineus muscle. Pectineus muscle identification itself a worth a question to ask. Identify the marked muscle identify the marked muscle, give the nerve supply of the marked muscle, the action of the marked muscle. Anything can be given. Identification of muscles, very, very important. That too pectineus. You may get the question in the INCT exam or NEET or FMG exam. Okay. Now these are muscles forming the floor. Next. Now what are the contents of the femoral triangle? The contents we're going to see from lateral to medial. The lateral most content of the femoral triangle is lateral femoral cutaneous nerve. It is our lateral femoral cutaneous nerve. Lateral femoral cutaneous nerve. And then we see femoral nerve. So femoral nerve is divided into anterior division and posterior division after passing below the inguinal ligament. Now the point is the femoral nerve which is not enclosed by the femoral sheath, which is lying lateral to the femoral sheath. So this is our femoral nerve. Okay. And then we have the femoral sheath. Now the femoral sheath is having 3 compartments. And the femoral sheath, the lateral compartment of the femoral sheath, we have femoral artery. And in the intermediate compartment of the femoral sheath, we have femoral vein. The femoral vein is receiving the great saphenous vein. And the middle compartment of the femoral sheath, you have the femoral canal, which contains deep inguinal nodes. I will mark the parts and then I will explain. Deep inguinal nodes, also known as cloacae nodes. Okay. Yes. Now these are the contents you have to remember for the femoral triangle. So we explain this content one by one. Now I told you the contents we're going to see from lateral to medial aspect. The lateral most content of the femoral triangle is, what is that? Lateral femoral cutaneous nerve. Number 2, femoral nerve. I told you femoral nerve is lying lateral to the femoral sheath. Femoral nerve, it is not enclosed by the femoral sheath. Okay. Next, the femoral sheath and its contents. I told you femoral sheath is having 3 compartments. The lateral most aspect of the femoral sheath, which contains the femoral artery. Along with the femoral artery, one nerve is coming down and it pierces the femoral sheath and it comes out of the femoral sheath and that supplies the skin over the femoral triangle. That fellow is our femoral branch of genitofemoral nerve. I'm talking about this fellow. Femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve, which is passed along with the femoral artery and pierces the femoral sheath laterally and then comes out and supply the skin over the femoral triangle. Okay. In the intermediate compartment of femoral sheath, we have femoral vein. And the femoral vein is receiving one vein. Which vein? This vein. That is our great saphenous vein. That is our great saphenous vein. Okay. Now in the medial compartment of the femoral sheath, which contains space, that space is called femoral canal. And the femoral canal contains node. Only lymph node is present. That is our deep inguinal nodes or cloacae nodes. That is our deep inguinal nodes or cloacae nodes. Now these are the contents you have to remember for the femoral triangle. Again, the medial most content of the femoral triangle is not the femoral vein, deep inguinal nodes or cloacae nodes. Please don't forget. You may get the question. Arrange the structures, arrange the contents of femoral triangle, lateral to medial, medial to lateral. Likewise, you may get the question. The medial most content of the femoral sheath, the middle most content of the femoral triangle, same. Our deep inguinal nodes or cloacae nodes. See the question carefully. The lateral most content of the femoral triangle, lateral femoral cutaneous nerve. Very good. The lateral most content of the femoral sheath, femoral artery. Please read the question carefully. Okay, right. You may get the question about femoral sheath or the femoral triangle. So now these are the contents from lateral to medial. Okay. Now see the diagram. In the diagram, yes, we are seeing the contents. Now can you see the small nerve here? Yes, that is our lateral femoral cutaneous nerve. Okay. And then you are seeing the femoral nerve. Yes, not a content of femoral sheath. And then femoral artery, femoral vein, and the femoral vein is receiving great saphenous vein, and middle to the femoral vein we have, yes, deep inguinal nodes or cloacae nodes. Clear? Right. So now next thing we're going to discuss about femoral sheath. See, femoral sheath is nothing but it is the fascia over the proximal part of femoral vessels. It is a fascia over the proximal part of femoral vessels. Okay. Now we have two layers, front side and back side. There is anterior layer and the posterior layer. Now this is anterior layer and there is a posterior layer. The anterior layer of the femoral sheath is coming from fascia transversalis. Fascia transversalis. And the posterior layer is coming from fascia iliaca. Fascia iliaca. Right. Anterior layer is coming from fascia transversalis and the posterior layer is coming from fascia iliaca. Right. Next, one important relation we're going to see. There is one structure which is passing behind the femoral sheath. What structure? That is our nerve to pectineus. So please put one box and then write. This is very important relation. You may get in the exam. Nerve to pectineus. Nerve to pectineus. It is a branch of the femoral nerve, trunk of the femoral nerve, which pass behind the femoral sheath. Which pass behind the femoral sheath. This relation is very important. Okay? Right. And two structures pierce the femoral sheath, laterally and medially. Laterally, the femoral sheath is pierced by, see the diagram? Laterally, the femoral sheath is pierced by our femoral branch of genitofemoral nerve. So, femoral branch genitofemoral nerve, which is passing along the femoral artery, in the middle of the sheath, it pierces the femoral sheath in the lateral aspect. So, laterally, the femoral sheath is pierced by the femoral branch of genitofemoral nerve. Medially, the femoral sheath is pierced by this fellow, that is our great saphenous vein. So, two structures piercing the femoral sheath. Laterally, femoral branch of genitofemoral nerve. Medially, by great saphenous vein. Right. Next, what are the compartments of the femoral sheath and what are structures passing through these compartments? Now, we're going to draw one diagram. Now, this is our femoral sheath. So, femoral sheath is having three compartments: lateral, intermediate, and medial. Now, in the lateral compartment of the femoral sheath, we have an artery. What artery? Femoral artery. I told you the femoral artery is accompanied by one nerve, the femoral branch of genitofemoral nerve, which appears sheath in the middle and then comes out like this. So, this is lateral compartment, this is medial compartment, and this is intermediate compartment. So, lateral compartment, we have femoral artery and this one femoral branch of genitofemoral nerve. In the intermediate compartment, we have vein. What vein? Femoral vein. That is the femoral vein. The femoral vein is receiving, yes, great saphenous vein. Femoral vein, and this is our great saphenous vein. Next, middle compartment. Medially, we have a space. Now, this space is called femoral canal. See, femoral canal, it is a dead space which allows the expansion of femoral vein. Now, the femoral canal contains only node, lymph node. Our deep inguinal nodes or cloacae nodes present. Deep inguinal nodes or cloacae nodes present in the femoral canal. Okay, right. Next one. The upper part of the femoral canal, you see one small defect, one small opening, that is called femoral ring. So, this is our femoral ring. That is our femoral ring. So, femoral ring, it is a defect in the upper part of the femoral canal. Now, we have to know the boundaries of the femoral ring. Now, this is our femoral ring. Okay. So, now I told you the upper part of the femoral canal, we have a defect. The defect is called femoral ring. Now, we have to know the boundaries of femoral ring. Why? Through femoral ring, one hernia will occur. Which hernia? Femoral hernia. So, that is why we have to know the boundaries of the femoral ring. Now, see the diagram. This is the femoral ring. Yes. Now, medial to the femoral ring, we are seeing one ligament. What ligament? Our lacunar ligament, forming the medial boundary of the femoral ring. Laterally, we have a vein. What vein? Our femoral vein form the lateral boundary of the femoral ring. In front, inguinal ligament. This is inguinal ligament. The front side. So, inguinal ligament form the anterior boundary. Behind the femoral ring, we have the muscle. What muscle? Pectineus muscle, posteriorly. Okay, pectineus muscle, posteriorly. And also formed by one more ligament behind the muscle, that is the pectineal ligament of Cooper, Cooper's ligament. Now, this is the boundary for femoral ring. So, I repeat. So, femoral ring is a defect in the upper part of the femoral canal. Now, through femoral ring, the femoral hernia will occur. Now, medial to the femoral ring, lacunar ligament. Lacunar ligament, I told you in the abdomen pelvis itself, it is a modification of extension of inguinal ligament. Lacunar ligament forming the medial boundary of the femoral ring. Laterally, femoral vein. In the front side, inguinal ligament. Back side, pectineus muscle and the pectineal ligament of Cooper. Now, this is the boundary for the femoral ring. Okay? Right. Now, one more point is, what is the relation of femoral ring in relation to pubic tubercle? Now, again, we're going to draw one small line diagram. Now, this is our pubic symphysis. Okay. And then this is pubic tubercle and the pubic crust. This is pubic crust and this is pubic tubercle. The femoral ring is present below and lateral to pubic tubercle. That is our femoral ring. And above and middle to pubic tubercle. Here, that is our superficial inguinal ring. Superficial inguinal ring. And the femoral ring is present below and lateral to pubic tubercle. Superficial ring is above and medial to pubic tubercle. So, in relation to pubic tubercle, please remember the superficial inguinal ring is present above and medial to the pubic tubercle. Femoral ring is present below and lateral to pubic tubercle. This relation you have to know, because in the recent exams, if they want to ask any question about the femoral hernia or inguinal hernia, they use this relation only. 50-year-old male came to emergency department with the complaints of swelling in the groin. On examination, the surgeon identified the swelling is above and middle to pubic tubercle. That means the hernia is occurring through superficial inguinal ring, that is the inguinal hernia. So, inguinal hernia is above and middle to pubic tubercle. Right. Next question. A 50-year-old female came to emergency department with the complaints of swelling in the groin. On examination, the swelling is found to be below and lateral to pubic tubercle. That means the hernia is occurring through femoral ring. What hernia? Femoral hernia. So, please remember the relation of these two openings in relation to pubic tubercle. Please don't forget. Right? So, the lateral compartment, femoral artery, and the femoral branch, genitofemoral nerve. Intermediate compartment, femoral vein, and medially, yes, Crockett nodes. Now, the point is, see the relation of femoral vein and the femoral artery. Femoral artery is lateral to femoral vein in the femoral triangle. Please remember, please put one small box and then write. The femoral artery is lateral to femoral vein. Where, sir? In the femoral triangle. This relation will change. The femoral artery becomes anterior to femoral vein in the adductor canal. Okay, so now in the femoral triangle, femoral artery is lateral to femoral vein. Okay, in the femoral triangle. So now we are going to see the contents of the femoral triangle in the cadaveric image. It's a cadaveric image, yes. Now see the boundaries of the femoral triangle. Now this is medial side and this is lateral side. So laterally, sartorius muscle, medially, recto longus muscle, and above base is formed by inguinal ligament. Yes. What are the contents from lateral to medial? Now lateral femoral cutaneous nerve, lateralmost content we are not able to see in the diagram. It is not given. And next to that we are seeing femoral nerve. Now medial to femoral nerve, we have femoral artery. This is femoral artery. Okay. And middle to femoral artery, we are seeing femoral vein, and the femoral vein receiving great saphenous vein. And middle to that, we have the inguinal nodes, deep inguinal nodes on the cloacated nodes. And can you see some shining structure here? Yes, in front of that, that is the femoral sheath. Yes. Okay. So that's all about the your femoral triangle contents, femoral sheath, femoral ring, boundaries. Yes. Now next, we're going to see in detail about the femoral nerve. Okay. So now femoral nerve, we're going to write some basic points for the femoral nerve. So femoral nerve is a branch of femoral nerve. It is a branch of lumbar plexus. Okay. Femoral nerve, it is a mixed nerve, carries sensory fibers and motor fibers. Now femoral nerve root value, posterior division of L2, L3, L4. Okay. And after the formation, the femoral nerve, which is descending between the two muscles. What muscles? This is psoas major muscle and this is iliacus muscle. Now between these two muscles, the femoral nerve is coming. This is femoral nerve. Okay. So femoral nerve, which is descending between the iliacus muscle and the psoas major muscle, and which pass below the inguinal ligament. So this is our inguinal ligament. So the nerve pass behind the inguinal ligament. Behind the inguinal ligament. And we know in the thigh, the femoral nerve, it is lying lateral to the femoral sheath. Lying lateral to femoral sheath, which is not enclosed by the femoral sheath. Okay. Right. And the femoral nerve, after that, divided into two divisions, anterior and posterior division. Okay. Now, what is the structure which is present between the anterior division and the posterior division of the femoral nerve is this artery. Okay. That is our lateral circumflex femoral artery. Now, lateral circumflex femoral artery, that is the artery which is present between anterior and the posterior division of the femoral nerve. Okay. Right. So very important question. What is the structure which divide the femoral nerve into anterior and posterior division? Our lateral circumflex femoral artery, which is present between the two divisions of the femoral nerve. Okay. These are the basic points you have to know. So first point, it is a branch of lumbar plexus, mixed nerve, root value, posterior division of L2, L3, L4. The femoral nerve, yes, alter the origin, which descend between iliacus and the psoas major muscle, and then which enter the thigh by passing below the inguinal ligament, and in the thigh, the nerve is lying lateral to the femoral sheath, which is not enclosed by the femoral sheath, and then divided into anterior division, posterior division, and we have one artery present between these divisions, that is our lateral circumflex femoral artery. Clear? Yes. Now see the diagram. Now this is the line diagram. So now we're going to see branches. What are the branches given by the femoral nerve? The trunk of the femoral nerve gives two branches. What are those? Number one, branch to iliacus and branch to pectineus muscle. Nerve to pectineus muscle. Nerve to pectineus muscle, I told you the relation is very important. What is that? The branch to pectineus, nerve to pectineus, which is present, which is going posterior to the femoral sheath, and then supply the pectineus muscle. Very important. Nerve to pectineus is present behind the femoral sheath. Okay. Right. Now we have an artery, that is lateral circumflex femoral artery, which is dividing the femoral artery into anterior division and the posterior division. Okay. Right. Next one. Now what are the branches given by the anterior division of femoral nerve? The anterior division of femoral nerve, gives two cutaneous branch and one motor branch. What are those? Medial cutaneous nerve of thigh, intermediate femoral cutaneous nerve of thigh. Now these two are cutaneous branches from the anterior division of the femoral nerve. Please remember, Only medial and intermediate cutaneous nerve of thigh branch of femoral nerve, not lateral femoral cutaneous nerve. Lateral femoral cutaneous nerve is a branch of lateral femoral cutaneous nerve. It's a branch of direct branch of lumbar plexus. I hope you know that. Okay. So in the cutaneous nerve of thigh, the femoral nerve gives medial and intermediate cutaneous nerve of thigh. And what's a motor branch? Motor branch to one muscle. What muscle? Sartorius muscle. So anterior division gives 3 branches, 2 cutaneous branch and 1 motor branch. Motor branch to sartorius muscle. Okay, right. Next, what are the branches from the posterior division? The posterior division gives 4 motor branch to the 4 heads of quadriceps femoris muscle. A branch to rectus femoris. Branch to rectus femoris muscle. Branch to vastae lateralis, vastae intermedius and vastae medialis. Please remember, the branch to pectineus muscle, which also supplies hip joint, also gives a twig to hip joint. The branch supplying the rectus femoris also gives a twig to hip joint. And the branch supplying the vastae medialis also gives a twig to knee joint. Okay? And the posterior division of the femoral nerve, which in turn continue as the saphenous nerve. So saphenous nerve, it is nothing but it is a continuation of the posterior division of the femoral nerve. The saphenous nerve, please remember, it is the longest cutaneous nerve in the body. Okay. Now, I told you in the cutaneous innervation of the lower limb, the saphenous nerve carries sensory fibers from the medial side of the leg. So saphenous nerve, it is the longest cutaneous nerve in the body. It's a continuation of posterior division of the femoral nerve, which carries sensory fibers from the medial side of the leg up to the ball of great toe. We already know. We discussed this point in the cutaneous nerve lower limb itself. Now these are the branches you have to remember for the femoral nerve. That's all about the femoral nerve. Now next, we're going to discuss about the obturator nerve. See, obturator nerve, I told you already, it is a nerve of the medial compartment of thigh. That's adductor muscles. Okay, right. So now, see the diagram. Now the obturator nerve, it is a branch of, again, lumbar plexus. It is a branch of lumbar plexus. Again, we know the root value. It is the anterior division of L2, L3, L4. And then, after the formation, the obturator nerve, it is giving relation to ovarian fossa. Now, what is the boundary of the ovarian fossa? We draw one small line diagram. Now, this is the common iliac artery. The common iliac artery is divided into external iliac artery and the internal iliac artery. So, this is our common iliac artery and divided into external iliac artery and the internal iliac artery. Now, the ovarian fossa is present here. So, this is the ovarian fossa. That is where the ovary is present, ovarian fossa. Now, behind the ovarian fossa, we have one tube, that is our ureter. Now, in the lateral wall of the ovarian fossa, we have the obturator vessels and nerves. Obturator vessels and nerves, they are passing in the lateral wall of the ovarian fossa. Now, these three structures are obturator vessels and nerve, forming the lateral wall of the fossa. So, now what is the boundary of the ovarian fossa? Now, in the front side, anteriorly, your external iliac vessels. External iliac vessels in the front side. Posteriorly, internal iliac vessels and ureter. Now, in the lateral wall of the ovarian fossa, we have the obturator vessels and nerve. So, obturator vessels and nerve, they form the lateral boundary of the ovarian fossa. So, why we have to know this? See, any structure with the clinical significance, surgical significance will be our question. That is what they are asking in the recent NEET and INSET exams. Now, the obturator nerve, I told you, it is forming the lateral boundary of the ovarian fossa. So, in the case of ovarian pathology, now the structure in the lateral wall, the obturator nerve is compressed. Now, when the obturator nerve is compressed, then the patient have pain in the medial side of the thigh. That is why they are asking this question. So, in the case of ovarian pathology, the pain radiating to the medial side of the thigh. Why? Due to the compression of which nerve? Yes, our obturator nerve. Okay, so please remember the obturator nerve forming the lateral boundary of the ovarian fossa. That is why in the case of ovarian pathology, the patient complains of pain in the medial side of the thigh. Then the obturator nerve which passes through obturator foramen and then divided into anterior division and posterior division. Now here we have one muscle which is present between the anterior division and the posterior division. Which muscle? Adductor brevis muscle. Adductor brevis muscle, it is present between the anterior division and the posterior division of the obturator nerve. I told you one structure which is present between anterior and the posterior division of the femoral nerve. That is the artery. Which artery? Our lateral circumflex femoral artery. Very good. So lateral circumflex femoral artery present between the anterior division and the posterior division of femoral nerve. In the case of obturator nerve, which muscle? Adductor brevis muscle. So adductor brevis muscle, please underline and then write, that is present between the anterior and the posterior division of the obturator nerve. Right. Now, what are the branches from the anterior division? Now, from the anterior division, yes, it gives a branch to pectineus muscle. Pectineus muscle also supplied by femoral nerve. Pectineus muscle, hybrid muscle. Two nerves supply, femoral nerve and the obturator nerve. Obturator nerve also giving a branch to hip joint. Okay. Now, from the anterior division, yes, we have branch to adductor longus muscle, gracilis muscle, and it also gives a branch to the adductor brevis muscle. So, our anterior division give a branch to pectineus muscle, adductor longus muscle, gracilis muscle, and adductor brevis muscle. These are the four muscles supplied by the anterior division of the obturator nerve. The anterior division of obturator nerve also gives a branch to femoral artery. Okay. And one more thing, below the adductor longus muscle, the anterior division of obturator nerve, which joins with medial femoral cutaneous nerve and saphenous nerve, and it forms subsartorial plexus. It forms subsartorial plexus. Now, subsartorial plexus carries the sensory fibers to the medial aspect of the thigh. This is very important. That is why they are asking this question. So, the medial aspect of the thigh, in the lower part, it is supplied by subsartorial plexus. The subsartorial plexus, which is formed by joining of three nerves. What are those? Anterior division of obturator nerve, medial femoral cutaneous nerve, and the saphenous nerve. Okay, they form subsartorial plexus and they carry sensory fibers in the middle side of the thigh, in the lower aspect. Okay, right. Now, what about the posterior division? The posterior division of obturator nerve, which will give a branch to obturator externus muscle, and it also supplies the adductor part of adductor magnus muscle. I told you in the beginning itself, adductor magnus muscle is having two components, adductor component and the hamstring component. Adductor component is supplied by the posterior division of obturator nerve, and the hamstring part is supplied by the tibial part of sciatic nerve. Yes, we know this one already. And it also gives a branch to adductor brevis muscle. If adductor brevis is not supplied by anterior division, then the posterior division gives a branch to adductor brevis muscle. Okay. Now, the important point is the posterior division of obturator nerve passes through one opening. I am talking about this opening. That is an opening present in the adductor magnus muscle. That is the adductor hiatus. That is the adductor hiatus. So, adductor hiatus, it is an opening present in which muscle? Adductor magnus muscle. I told you the posterior division of obturator nerve, which passes through adductor hiatus and reaches the back of knee joint, and which supplies the knee joint and popliteal artery. That is the point. Okay. So, the posterior division of obturator nerve passing through this opening and reaches the back of knee joint and supplies the knee joint and the popliteal artery. Now, the question is, what are the other structures passes through this adductor hiatus? Now, the other structures passes through the adductor hiatus is our femoral artery, femoral vein, And one more structure, just now I told you, the posterior division of obturator nerve. So three structures passes through adductor hiatus in the adductor magnus muscle. What are those? Femoral artery, femoral vein, and the posterior division of obturator nerve. The femoral artery, femoral vein passes through the adductor hiatus and they reach the back of knee joint, and they in turn continue as popliteal artery and popliteal vein. Okay, and the posterior division of obturator, just now I told you, it reaches back of knee joint and supply the knee joint and the popliteal artery. Okay, yes. So now these are the points you have to remember for the obturator nerve. So now we're going to summarize the information for the obturator nerve. Okay, now the anterior division of obturator nerve, which gives a branch to muscles. It gives motor branch. Okay, it gives a branch to hip joint, so articular branch. It gives a branch to femoral artery, so vascular branch, and it also gives cutaneous branch by giving contribution to the subsartorial plexus. Okay, now what about the posterior division? The posterior division of obturator nerve gives motor branch to the muscles, and it gives a branch to knee joint, so articular branch, and it also supplies the popliteal artery, vascular branch. The point is, the posterior division of obturator nerve, it is not giving cutaneous branch. Okay, these are some basic points you have to know about the obturator nerve. Right. Next, we're going to see the muscles. Now in the front of thigh, we're going to discuss two muscles. Okay, right, our quadriceps femoris muscle and sartorius muscle. See, the name itself, we have a clue. The muscle is having how many heads? 4 heads. What are those? Rectus femoris muscle and 3 vastae muscles. Vastae medialis, vastae intermedius, vastae intermedius, and vastae lateralis. These 4 muscles form the quadriceps femoris muscle. Okay, so now nerve supply already we know. So muscles in the front of thigh is supplied by the femoral nerve. The quadriceps femoris is supplied by the posterior division of femoral nerve. Okay, now we're going to see one by one. The rectus femoris muscle. See, rectus femoris muscle, it is the muscle takes origin from anterior inferior iliac spine. Rectus femoris muscle, origin from this point, anterior inferior iliac spine. Origin is from hip bone, ilium bone, anterior inferior iliac spine. So rectus femoris muscle, which is crossing the hip joint in the front side. So what is the action of the rectus femoris muscle at the level of hip joint? Rectus femoris muscle, I told you this muscle is crossing the hip joint in the front side, which cross the hip joint anteriorly, yes, because it takes origin from anterior inferior iliac spine. Okay, from the anterior inferior iliac spine, the muscle is taking origin. So this muscle is crossing the hip joint in the front side. Now what is the action of rectus femoris muscle at the level of hip joint? Rectus femoris muscle at the level of hip joint, it is flexing the hip. Okay, right. Now what about the 3 vastae muscles? The 3 vastae muscles, they take origin from femur bone. The vastae muscles take origin from femur bone. Now the point is, the 3 vastae muscles, do they have any action at the level of hip joint? No action at the level of hip joint. Why? Origin from femur bone. It is not taking origin from hip bone. The muscle is taking origin below the hip joint. So the vastae muscles, please underline and then write no action at the hip joint. Why? They take origin from femur bone. Again, this basic detail is enough. The vastae muscle take origin from femur bone. That is enough. The point is, no need to know the exact origin for all these muscles. Just remember the basic idea. The vastae muscles take origin from femur bone, so they don't have any action at the level of hip joint. Okay, right. Now, see here. Now, the 3 vastae muscles and the rectus femoris, they form one common tendon. What is that? Quadriceps femoris tendon. They form quadriceps femoris tendon. In the tendon of quadriceps femoris, one sesamoid bone is formed. Can you see the sesamoid bone here? Yes, that is our patella bone. That is the patella bone. So patella is the sesamoid bone which is formed in the tendon of quadriceps femoris. Right. Now, the quadriceps femoris tendon cross the knee anteriorly and inserted to tibial tuberosity. Attached to tibial tuberosity. Now, the quadriceps femoris tendon crossing the knee anteriorly. Now, what is the action of this tendon at the level of knee joint? Sir, you only told, sir. Muscles crossing the joint in the front side do flexion. Muscles crossing the joint on the back side do extension. So, the quadriceps femoris tendon flex the knee. No. See, we bend the knee joint only on the back side, not in the front side. Now, this is a leg. So, during the development, the leg rotates medially like this. This is flexor compartment. This is extensor compartment. So, leg will be like this. The leg rotates medially like this. Now, because of this, the extensor compartment coming to the front side and the flexor compartment go to back side. That is why we bend the knee joint on the back side. So, muscle crossing the knee on the back side, what they do? Flexion. Muscle crossing the knee in front, what they do? Extension of the joint. So, please remember, because the leg rotates medially. Now, because of that, the flexor compartment of the leg goes to back side, posterior side, and the extensor compartment in the front side. So, the point is, the muscle crossing the knee anteriorly, what they do? Extension of the joint, extension of the knee. So, muscles cross the knee posteriorly, what they do? They flex the knee. That is the point. Now, the quadriceps femoris tendon, I told you, it is crossing the knee in the front side. So, what they do? Yes, very good. Extend the knee. So, please remember, the quadriceps femoris tendon, what is the action at the level of knee joint? Extension of knee. Okay. So, now we're going to write the summary. What is that? Now, what is the action of the rectus femoris muscle? Now, rectus femoris muscle cross the hip in front and cross the knee in front. It is crossing the hip in front. What they do? Hip flexion. They cross the knee in front. Knee extension. Now, what about the vasti muscles? The vasti muscles, I told you, they have action only in the knee joint. So, they extend the knee. One time they gave this question, very old question. The only quadriceps femoris muscle which is having the action in the hip joint. What muscle? Our rectus femoris muscle. Rectus femoris muscle, it is the only muscle in the quadriceps femoris which act at the hip joint. Okay? That's all about the quadriceps femoris muscle. Now next, one more muscle we're going to see, that is our sartorius muscle in the front of thigh. Now sartorius muscle origin from anterior superior iliac spine. Our rectus femoris muscle from anterior inferior iliac spine. This muscle sartorius anterior superior iliac spine. Now sartorius muscle, after the origin which cross the hip joint anteriorly, and this muscle is present in the lateral aspect. Yes, this is medial and this is lateral. Now sartorius muscle, yes, from the origin point crossing the hip in the front side, and this muscle is on the lateral side. Okay, right. Now what is the insertion of sartorius muscle? Now sartorius muscle, which is inserted to the medial side of the tibia, the medial surface of tibia. This muscle is passing on the medial side of the knee joint. So the muscle is passing on the medial side of the knee joint and finally attached to the medial surface of tibia along with two more muscles. What are those? Your gracilis muscle and semitendinosus muscle. So three muscles have their common insertion. What are those? The semitendinosus, gracilis, and our sartorius muscle. These three muscles, they have a common insertion to the medial surface of tibia. Now, these three tendons, attachment in the tibia, which is looking like the duck's leg. That is why it is called pes anserinus muscle. Pes means leg, anserinus means duck. Now, the attachment of these three muscles on the middle surface of tibia, which is looking like a duck's leg. So, these three muscles are called pes anserinus muscle. So, pes anserinus pattern is formed by how many muscles? Three muscles. What are those? Sartorius, gracilis, and semitendinosus muscle. Now, these three muscles also called gyropes muscle. Also called gyropes muscle. Now, gyros muscle means, now these three muscles, they take origin from the hip bone. And insertion, it is not to femur bone, inserted to tibia bone. So, these three muscles, they act as a long rope which stabilize the hip bone to the tibia. Which stabilize the hip bone to the tibia. So, these three muscles, they act as a rope which stabilize the hip bone to the tibia. That is why these three muscles also called gyropes muscle. Okay, so gyros muscle, sartorius, gracilis, and semitendinosus. Is that clear? Yes. So now insertion of sartorius over. Now supply, I told you, the anterior division of the femoral nerve. Now what is the action of sartorius at the level of hip joint, at the level of knee joint? Sartorius muscle related to hip joint and knee joint. If you want to know the action of any muscle, just follow this rule. Origin point, fixed point, and the insertion point move towards the origin point. So now the insertion point, it is moving towards the origin point like this. So insertion point is medial, origin point is lateral. So now the muscle move the hip bone towards the lateral side. So now what is the action of sartorius at the level of hip joint? Number one, this muscle is crossing the hip joint in the front side. So we know the action. Number one, flexion. Number two, I told you, insertion point is medial, origin point is lateral. So now this muscle move the hip joint laterally. Lateral rotation of the hip joint. And while doing lateral rotation, the muscle also do abduction. The muscle doing abduction do lateral rotation. Okay, so now we have three actions at the level of hip joint or sartorius. What are those? Hip flexion. Number two, lateral rotation. Number three, abduction. Fine. Now what is the action of sartorius at the level of knee joint? Now knee joint, the muscle is present on the middle side of the knee joint. So this muscle do medial rotation and also do mild flexion. Now these are the 5 actions of sartorius at the level of hip joint. Flexion, number 2, lateral rotation, number 3, abduction. At the level of knee joint, number 1, medial rotation, number 2, flexion. Okay, these are the 5 actions of sartorius. Now this action is used by the tailor while stitching. That is why this muscle is called sartorius muscle. That is tailor's muscle. Sartor means tailor. Tailor's muscle. Okay, and action of sartorius question was asked in 2022 INACT exam. 2022 May INACT we got this question. Okay, right. That's all about the sartorius muscle. Now next we're going to see the 2 anatomical landmarks. One is adductor canal and another landmark behind the knee joint, that is a popliteal fossa. Now we're going to draw one simple line diagram. Now this is our femoral triangle, and below that the adductor canal will start. Okay, and below the adductor canal, and this is our popliteal fossa. So now this is our femoral triangle, this is the adductor canal, and this is the popliteal fossa. So popliteal fossa, it is a fossa behind the knee joint, a diamond shaped fossa behind the knee joint. Okay, right. Now the femoral artery, which passes through the femoral triangle and then enter the adductor canal. Now adductor magnus muscle, it is forming the boundary of the adductor canal. Now through one opening, adductor hiatus in the adductor magnus muscle, the femoral artery passes through and enter the back of knee joint, they enter the popliteal fossa, and the name of the artery is changed to popliteal artery. That is our popliteal artery is nothing but continuation of femoral artery. So femoral artery from the femoral triangle reach the popliteal fossa through the adductor canal. Now another important advantage of the adductor canal is the femoral vessels are easily accessible here. So if you want to ligate the femoral vessels, then the surgeon use this canal. Okay. Now what is the boundary of the adductor canal? Now the roof of the adductor canal is formed by sartorius muscle. So sartorius muscle is forming the roof. If you want to see the canal, first we have to lift the sartorius muscle. Below the sartorius muscle only, you see the adductor canal. So sartorius muscle forms the roof. Okay. And this is a femur bone. And we have a muscle attached to the posterior border of the femur bone. The posterior border of the femur is formed by linea aspera. Now in the linea aspera, the vasti muscles and the adductor longus muscle are attached. So vasti medialis muscle, which is forming the anterolateral boundary of the canal, and adductor longus muscle, and below that adductor magnus muscle, adductor longus and adductor magnus muscle, they form posteromedial boundary of the canal. Okay. So what are the boundaries? In the roof, sartorius muscle, anterolaterally vastus medialis muscle, and posteromedially adductor longus and adductor magnus muscle. This is the boundary of the canal. Now what are structures passing through the canal? I told you already, the femoral vessels. From the femoral triangle, they reach the popliteal fossa through the adductor canal. So the contents are the femoral artery and the femoral vein. Now the importance is, what is the relation of femoral artery and the femoral vein? In the femoral triangle, I told you, in the femoral triangle, the femoral artery is lateral to femoral vein. But see the canal. Now in the canal, see the femoral artery and femoral vein. Femoral artery is anterior to femoral vein. That is important. So please write, note, contents, femoral artery and femoral vein. So femoral artery is anterior to femoral vein. That is very important. Okay. So contents, femoral artery and femoral vein. How they are oriented? Femoral artery is anterior to femoral vein. And there is one nerve which is anterior to femoral artery. What is that? Our saphenous nerve. So saphenous nerve content of the adductor canal, which is anterior to femoral artery. Okay. Right. Next, nerve to vasti medialis. Supplies the vasti medialis muscle, branch of femoral nerve, posterior division of femoral nerve. Now these are the 4 contents you have to remember for the canal. What are those? Femoral artery, femoral vein, saphenous nerve, and nerve to vasti medialis. Clear? Yes. That's all about the adductor canal. So now we're going to see the boundaries of the femoral triangle. Now in that, yes, we are seeing one muscle in the front of thigh, that is our sartorius muscle. So sartorius muscle, medial border, and this is adductor longus muscle. Adductor longus muscle, medial border, and above we have the inguinal ligament. Now these 3 structures, yes, they form the femoral triangle boundaries. Okay. So it is bounded between the medial border of adductor longus muscle, medial border of sartorius, and above inguinal ligament. Okay. Right. So now what are the muscles forming the floor of the femoral triangle? Now from lateral to medial, number 1, iliacus muscle, and then psoas major muscle, and then pectineus muscle, and adductor longus muscle. So adductor longus muscle forming the boundary and also the floor muscle. Now we're going to see the boundaries of the femoral ring. So femoral ring is the defect or opening in the upper part of the femoral canal. Now that is our femoral ring. Okay. Right. Now boundaries of the femoral ring. Now medially you are seeing one ligament there, that is our lacuna ligament forming the medial boundary. Now in the front side, yes, you are seeing the ligament, another ligament, that is our inguinal ligament. Posteriorly, we are seeing pectineus muscle and the pectineal ligament of Cooper. Laterally, one vein, that is our femoral vein. Now, this is the boundary of the femoral ring. Femoral ring boundary is very important. Okay, right. Now, boundaries again, medially, you are seeing the lacunar ligament, right? That is the femoral vein on the lateral side. Okay. Now, inguinal ligament in the front side. Okay. Femoral hernia occurs through femoral ring. Now, this femoral ring is much wider in female. So, femoral hernia most commonly seen in females. Okay. So, these are the animations you have to see about the boundaries of the femoral ring. So, now we're going to see muscles in the adductor compartment. For that, yes, we're going to remove the iliacus muscle, psoas major muscle, and sartorius muscle. We're going to remove these three muscles to get a clear view of adductor muscles. Okay. Now, in the superficial compartment, we are seeing pectineus muscle, next adductor longus muscle, and gracilis muscle. Next, we're going to remove adductor longus muscle so that you can see the adductor brevis muscle and below that adductor magnus muscle. Now, with the adductor magnus muscle, you are seeing the opening that is called adductor hiatus. Now, through which the femoral vessels go to the back of knee joint and then continue as the popliteal vessels. Okay, the adductor hiatus transmit femoral artery and femoral vein. Now, one more muscle is there, that is our obturator externus muscle. If you want to see that muscle, we have to remove pectineus muscle. If you remove the pectineus muscle, then we are seeing that muscle, a deep muscle, obturator externus muscle. Now, all these muscles are supplied by our obturator nerve. These are the muscles in the adductor compartment. We're going to see the rectus femoris muscle, a part of the quadriceps femoris muscle. Okay. So, quadriceps femoris muscle, first part, rectus femoris muscle, a straight muscle in the femur. See the origin point? That muscle takes origin from anterior, inferior iliac spine. That is the origin point. Now, the rectus femoris muscle, it is the only muscle having action at the level of hip joint. Now, if you remove the rectus femoris muscle, then we see three vastae muscles, vastae medialis, vastae lateralis, and in between, vastae intermedius. Okay, the three vastae muscles. Now, we are seeing one small part. That part is called articularis genu, a small detached part of vastae intermedius. Old neat question. Okay, so articularis genu is nothing but it's a detached part of vastae intermedius muscle. Okay, yes. Now, these are the muscles forming the quadriceps femoris muscle. Okay, so now we're going to see the boundaries and the contents of the adductor canal. Now, for this, we're going to take the section in this level. Now, if you take section in this level, then you are seeing the boundaries of the adductor canal. Okay. Now my hand exactly, yes, pointing towards the adductor canal. That is the adductor canal. Okay. Now, in the front side, you have one muscle. Which muscle? That is our sartorius muscle. Okay. Now, yes, adductor longus muscle, adductor magnus muscle present posteromedially, and anterolaterally we have vastae medialis muscle. Okay. Now, this canal is bounded between sartorius in the front side, that is a muscle which is forming the roof. So, if you want to see the canal, first we have to remove the sartorius muscle only. Okay. So, the sartorius muscle is forming the roof of the canal. Adductor longus and magnus muscle, posteromedial boundary, and vastae medialis muscle forming the anterolateral boundary. Okay. Now, see the contents. Now, contents, you're seeing one nerve there, yellow color there. That is our saphenous nerve. Saphenous nerve, branch of femoral nerve, content of this canal. Right. So, now we remove the saphenous nerve to see some more structures. Now, we are seeing one blue color there. Yes, that is our femoral vein. Okay. Now, if you remove the femoral vein, then in the front side, you are seeing one more artery there. That is our femoral artery. Okay, femoral artery. These are the contents of our adductor canal. Saphenous nerve, femoral vein, femoral artery, and one more nerve, nerve to vastae medialis. Okay, these are the boundaries and the contents of the adductor canal. Next, we're going to see the popliteal fossa. Now, the popliteal fossa, I told you already, it is the diamond-shaped fossa behind the knee joint, which is the diamond-shaped fossa behind the knee joint. Behind the knee joint. Okay, right. Now, what are the boundaries? Now, superior boundary is formed by hamstring muscles. Inferior boundary is formed by calf muscles. Very simple. Diamond-shaped fossa behind the knee joint. Now, above the knee joint, on the back side, what we have? Hamstring muscles. Below the knee joint, on the back side, we have calf muscles. That's all simple. So, superior boundary is formed by hamstring muscles. Inferior boundary of the fossa is formed by your calf muscles. Okay. Now, we're going to see the boundaries for this fossa. Now, this is superior and this is inferior. This is medial and this is lateral. So, we're going to draw a line diagram. So, now this is the diamond-shaped fossa. Now, this is superior and this is inferior. Now, we assume this is a medial side. This is medial side and lateral side. So, what are the boundaries of the popliteal fossa? Now, this superior and medial. Between these two, supromedially. Superior and lateral. Suprolaterally. Inferior and lateral. Infrolaterally. Inferior and medial. Infromedially. So, popliteal fossa is having supromedial, suprolateral, infromedial and infralateral boundaries. Supromedially is formed by hamstring muscles. What are those? Your semitendinosus and semimembranosus. So, supromedially, semitendinosus muscle and semimembranosus muscle. Semimembranosus muscle. Supralaterally formed by biceps femoris muscle. Biceps femoris muscle. Infromedially, medial head of gastrocnemius muscle. Medial head of gastrocnemius muscle. Infrolaterally, lateral head of gastrocnemius muscle and also by one small muscle, plantaris muscle. Okay, these are boundaries of the popliteal fossa. Supromedially, semitendinosus, semimembranosus. Supralaterally, biceps femoris. Infromedially, medial head of gastrocnemius. Infralaterally, lateral head of gastrocnemius and plantaris. Okay, right. See the boundary? Yes. So, supromedially, your semitendinosus and semimembranosus. Supralaterally, biceps femoris muscle. Supralaterally, this is biceps femoris muscle. Biceps femoris muscle. Now, infromedially, medial head of gastrocnemius and infrolaterally, lateral head of gastrocnemius. Can you see a small muscle here? Yes, that is our plantaris muscle. Okay, yes, boundaries over. Now, next thing, you have to remember the floor. What are structures forming the floor? Now, floor is formed by three structures. Now, this is number 1, this is number 2, and this is number 3. So, three structures forming the floor of the popliteal fossa. Number 1 is the popliteal surface of the femur. Popliteal surface of the femur. See, popliteal surface of femur, you may think that the popliteus muscle takes origin from here. No. The popliteal surface of femur, it is a bare area. Nothing is attached there. No muscle takes origin from that area. Popliteal surface of femur is a bare area. Okay. And number 2, the floor is formed by the oblique popliteal ligament. Now, oblique popliteal ligament, it is nothing but it is a modification of the extension of the insertion of semimembranosus muscle. Now, semimembranosus muscle, after inserting to tibia, it is giving some modifications. One of the modification is oblique popliteal ligament. Is nothing but extension of the insertion of semimembranosus muscle. This is the extension of the insertion of semimembranosus muscle. Semimembranosus muscle. Okay. Number 3, fascia over popliteus muscle. Number 3, yes, the fascia will be there over the popliteus muscle. These three structures forming the floor of the popliteal fossa. What are those? The popliteal surface of the femur, oblique popliteal ligament, and the fascia of the popliteus muscle. These three structures form the floor from above downwards. Right. Next. Now, what are the contents of the popliteal fossa? Now, the contents of popliteal fossa, what are those? Number 1, popliteal artery. Number 2, popliteal vein. Number 3, tibial nerve. Number 4, common peroneal nerve. And there is one vein which is draining into popliteal vein. Now I'm talking about this vein, that is our small saphenous vein. Small saphenous vein. Now two more nerves present. Again, we are not able to see in this diagram. Now your posterior division of obturator nerve. I told no in the obturator discussion. The posterior division of obturator nerve passes through adductor hiatus and they reach the popliteal fossa and they supply the knee joint and also the popliteal artery. So that fellow only, the posterior division of obturator nerve. Okay, and one more nerve is posterior femoral cutaneous nerve. And last content to remember is lymph node, popliteal lymph nodes. So these are the contents you have to remember for the popliteal fossa. So I repeat, contents are popliteal artery, popliteal vein, tibial nerve, common peroneal nerve, small saphenous vein, posterior division of obturator nerve, posterior femoral cutaneous nerve, and the popliteal lymph nodes. These are all the contents of the popliteal fossa. That's all about the popliteal fossa. Very simple topic. Yes, that's all about the adductor canal and the popliteal fossa.